Thanks for joining us this afternoon for the daily update. We have 5,353 cases of coronavirus in Victoria. That is 217 more than yesterday. Of those 217, 11 are connected with known outbreaks. One's in quarantine, and 205 of those cases are under investigation by our public health team. There are 2,608 active cases of coronavirus across the state. I'm saddened to have to inform you that 2 further Victorians have passed away, taking the total fatality number up as a result of this virus to 34. One woman in her 80s and one man in his 80s. If there are further details and it's appropriate to go through those at a later point, then of course we will, but we'll take this opportunity to send our best wishes, our condolences, our thoughts and our prayers to the families of those 2 Victorians. This will be a particularly sad and challenging time for them. In terms of testing, yesterday 28,104 tests, which means we've done 1,278,512 tests. So our testing rate per 100,000 is getting quite close to 20,000 tests per 100,000, which is quite an amazing effort, and we are deeply grateful to every single Victorian who's come forward over this long journey to get tested, to get to the best part of 30,000 tests yesterday, given the stay-at-home orders, given all the different challenges that we face, is a very impressive thing. It's so important to come forward even with the mildest of symptoms. Get tested. That's how we can isolate you. That's how we can isolate your close contacts. That's how we can limit the spread of this virus. We don't have any other announcements to make today in terms of, I think Jenny might have one more test site that's opened up, so we'll put that out there just so that people in that community can be aware of that. I just wanted to make a couple of general comments. It goes without saying, but we will make the point yet again, this is not an ordinary weekend. Stay at home means just that. It means stay at home unless you need to go out, and then only for the things that you absolutely need. So food shopping, things of that nature, getting care, giving care, those sorts of things, going to work, all of that is fine, but only if you need to. If you can work from home, you must work from home. If you don't necessarily need additional supplies, then you should not be going out to get those additional supplies. I know and understand it's frustrating, it's challenging. We'd all rather be in a very different position, but we can't ignore the reality that we face, nor can we be finding reasons, inventing reasons to travel a long way from home. Whether you're in Broadmeadows or Brighton, stay at home means stay at home. That's how we'll get this lockdown over sooner. It's how we will protect those in the community who are susceptible. And I again make the point, it's not only those frail aged Victorians. That itself is reason enough for us to all be vigilant. But just in case anyone thought this was only an issue for those who are very old and have underlying health issues, there is a growing number of people around the world who have been otherwise healthy and have passed away in ages across the whole spectrum. The other point too, as Brett made yesterday, I think it was, or perhaps the day before, that there is growing evidence about lingering effects, and whilst you may not die as a result of this virus, there are many people who are reporting this in effect as a chronic condition that lingers for a prolonged period of time. So this is not something anyone wants to get, and the notion that it's mild and it won't matter, that's just not right. The evidence does not bear that out. So again, I'm deeply grateful to everyone who is following the rules. That is the vast majority, but there will always be an isolated number of people. I just appeal to them to moderate your behaviour. For you, for your family, for every family, for the entire Victorian community, that is the only way we can go forward. It's the only way that we'll get these restrictions off sooner rather than later, and it's the only way we will avoid having to put in place even tougher rules. So everyone needs to play their part, and I am deeply grateful to everyone who is. Victoria Police are out there in force, and they will issue fines for people who are making choices that are much more about them than everybody else. We're just not in a place where people can do that. We all need to work together. We all need to be focused on the task at hand, and that's driving these numbers down further. having that sense of control and then being able to get past this second wave and move into a set of circumstances where we can start to open up the economy more, where we can have those numbers at such a low rate that we're confident that we can not only suppress them but essentially contain them at that very, very low level. So again, thank you to everyone who is, I know, deeply frustrated. No one's enjoying not being able to go and do all the things that we love, not being able to go and do all the things that are a normal part of a normal winter. But this is not a normal winter, and we can't pretend it's over just because we want it to be. We have to find that COVID normal, and sadly we have to embrace that, make the best of that, because that's the only way that we'll get past this second wave. I might ask Jenny now just to speak about test sites. Actually, just before I do that, can I just make a couple of comments in relation to Alfred Street Tower, which of course at 11:59 p.m. tonight, that hard lockdown comes to an end. I just want to be really clear with residents and with the broader community that lockdown doesn't end for every single resident. There are a number of people, maybe as many as a third of those residents, who are either close contacts of somebody who has tested positive or someone who has tested positive while that lockdown has been in place. So they still have days where they need to be in their residence and nowhere else. That is, I know, very challenging, but we will continue to provide groceries, perishable food, cooked meals. We'll continue to provide all the basics that those residents need, as well as mental health support, counselling. It's a massive team down there doing their very, very best. But whilst that 14-day lockdown ends tonight, the notion of quarantine, or the notion of being isolated in your residence, that will not end for a number of people for a number of days to come. And that means that's no different to any other resident, regardless of their landlord or their postcode, anywhere in metropolitan Melbourne. The other point, just to remind the rest of those residents who are not having to isolate, stage 3 stay-at-home orders, so only leaving for the 4 permitted reasons, that remains a feature. That's the set of restrictions you're moving into. It's not as if there are no rules that apply at 11:59 p.m. tonight just because the 14 days of hard lockdown have ended. There is still a framework, and everyone's expected to be part of that. Just finally, there's been an enormous effort made, and it continues throughout the day, because of course these restrictions don't come off until midnight tonight, but there have been many, many doors knocked on. People have been informed of what their status is, what the rules that apply to them are, but certainly a half, or perhaps more than that, of that tower will move to the same settings as the rest of metropolitan Melbourne and Mitchell Shire, but there will be a significant number of people who need to remain in their residence because they are either a close contact of a positive case or are positive themselves. I want to reassure every one of those tenants that they'll continue to receive the very strong support that has been a feature of our response, and I thank them for their patience, and I thank everyone in a massive team of people who are working as hard as they possibly can to provide the support that those often vulnerable Victorians need. Just finally, in terms of thank yous, there's a lot of media reporting today about us not relying upon the last line of defence, not simply leaving it to nurses and ambos and doctors to get us through this. If you value the work that our health professionals do, and it's the whole hospital team, it's cooks and cleaners and orderlies and ward clerks all the way through to surgeons, everyone in between, nurses, midwives, the whole team. If you value the work that they do, if you're like me, if you're in awe of their commitment, their compassion, their skill, and the work they do every hour of every day, then play your part, because the front line is every individual, every family, following the rules, doing the right thing, making those important sacrifices so that we don't have a situation where more and more and more Victorians are in hospital, are in intensive care, and there are even more tragedies than we have already seen. The front line is out there in suburban streets and neighbourhoods and homes. It is not in our intensive care. That's the last line of defence. And if you value the work that those amazing Victorians do, then send them a thank you by playing your part out there in your local community, in the choices you make. And again, I'm deeply grateful to the vast majority of Victorians who are making the right choices. It makes a powerful difference. If you're sick, come forward and get tested. That's the only thing you should be doing if you've got even the mildest of symptoms. Please follow the rules this weekend. It's not an ordinary weekend. It's far from that. The stakes are very high. And again, thanks to those who are doing the right thing. To those who aren't, make better choices, or you will be getting a fine. It's not only the wrong thing to do, it's just not smart, because Victoria Police are out there in force and they're not mucking about. Stay at home means just that. Stay at home. It's pretty simple, and it will work if we all do the right thing. I'll now ask Jenny to add to my comments, and then Brett can speak to the epidemiology of the day, and then we're happy to take any questions you have.
Thank you, Premier, and good morning. I do want to begin by acknowledging our dedicated nurses, doctors, and all of our healthcare professionals who are that last line of defence for all of us. They are turning up each and every day and putting themselves in harm's way to provide us with the support that we need at this challenging time. But we can all do our bit to keep them safe by staying at home. These are the people who cannot stay home, who need to turn up to work to care for us. And if we stay home, we can enable our hospitals to be well equipped and able to respond to patients needing a vast range of medical care. So they are well equipped, well resourced in terms of the investment that our government has provided. We have, of course, made some changes to elective surgery to give our hospital system greater capacity, and we are now also testing elective surgery patients to make sure we can minimise the risk to both patients and to healthcare workers. But we know that their job will be far, far easier if we all do our bit, and that is wear a mask when we're out and about outside of our home, staying at home as much as possible, and of course, most importantly, getting tested if we have even the mildest of symptoms. We have been expanding our testing sites right across Victoria. We have more than 160 testing sites across Victoria now, including 60 in regional communities, and we will continue to expand our testing sites to make it easier for Victorians to get tested, and this includes in regional communities. We stressed yesterday that regional Victorians should not become complacent, that this is a Melbourne issue, that we have cases in regional communities, including today and in recent weeks. And so it's important that those regional communities do wear a mask and do get tested even if they have mild symptoms. So today we have a new testing site that's open in Ballarat. That's at Ballarat Senior Citizen Centre. And that will be open and people will be able to be tested by appointment, and all of those details and all of the details of all of our testing sites right across Victoria are available on the DHHS website. I also want to point out that we have now 3 new nursing homes with reported cases today, and Brett will go into the details, of course, shortly of all of our new cases. 2 of those aged care homes are in regional communities, one in Ballarat, one in Bendigo, and I want to take this opportunity to thank my counterpart in the federal government, Minister Hunt, who has announced that they will be providing masks now to all nursing homes in Victoria, including in regional locations, to assist those healthcare workers to keep themselves and, of course, most importantly, to keep residents safe. And we continue to have very constructive discussions with the Commonwealth Government around our response to the particular risks and issues facing that aged care sector. Can I just also take the opportunity to acknowledge our community health centres, and the Premier referred to before 33 Alfred Street coming out of that hard lockdown at the end of today. I want to acknowledge CoHealth that has been going door to door, providing healthcare support to the residents of those particular towers, providing testing, providing other healthcare support. So I thank their dedicated staff, but also the staff of many of our health services and community health centres who've been working together right across public housing estates in Melbourne, making sure that some of our most vulnerable Victorians can get access to testing, as well as being provided with masks so that they can keep themselves safe. So for all of those thousands of people on the out there on the front line, whether they're at testing sites, they're in our pathology labs, whether they're in our health services or community health centres, working in the community, I say thank you. But all of us can express our deep gratitude and our support for our dedicated healthcare workers and all of our emergency services personnel that are supporting the community at this time by following the rules, wearing a mask, and most importantly, getting tested if you have even mild symptoms. Thank you.
Thank you, Minister. So today's number of 217 new cases is a relief after yesterday's number. Certainly a relief to someone like me who's been watching the daily numbers for 6 months and has always had the health and wellbeing of Victorians in mind. 217 is much better than a number above 400, but it's a number that would have shocked us all a month ago. We need to remember it's still a high number. It's going to contribute to the number of active cases, and again there'll be a number of people hidden in this number today who will require hospitalisation or intensive care in days to come. We have had a decrease in the total number of hospitalised patients. It's 110 as of today. That's decreased from 12 since yesterday. 25 patients in intensive care, which is fortunately a decrease of 6 since yesterday. 18 patients remain on ventilators, which is a decrease of 4 since yesterday. But we have got an addition of 11 healthcare workers. That now brings the total number of healthcare workers with coronavirus to 405. So again, I'd like to reinforce the Minister's message that we should really have our healthcare workers and the broader community in mind in doing everything that we know we need to do in staying home, in wearing a mask. These are not insignificant sacrifices. We know it's very difficult to have to spend weeks really limiting our movement, limiting the number of people that we can see, including our own families. On the issue of masks, I would say it's a pretty small sacrifice to make. I've got mine here, I think. So to wear them, you know, it's, I won't do a Greg Hunt, I'll put it on properly. It's a pretty simple technique. It's a very protective measure. It's not foolproof, but it will protect you, it'll protect those around you, and I would say always have the healthcare workers in mind in doing this, because this is the kind of thing that if we do across the community, whenever we're going in to an indoor space for one of those 4 reasons that we need to leave the house, we are reducing the risk of transmission, we are reducing these daily numbers, we're protecting everyone in the community, and we're protecting those healthcare workers who have to face those individuals who need to step up for care. In terms of outbreaks today, Altaqua College outbreak total is now 164, JBS Abattoir 33 cases, Glendale Aged Care in Werribee 23 cases, 21 cases in Northern Hospital, 3 cases linked to Warringal Hospital in Heidelberg, 9 cases at St Basil's in Fawkner, 5 cases linked to Clever Kids Childcare in Ashburton, 13 cases linked to Estia Health Aged Care in Heidelberg. But there'll be a fuller list of aged care and other outbreaks in the Chief Health Officer media release this afternoon.
Brett, can we ask Brett, sorry, the Minister mentioned 3 new aged care facilities. Are you able to name the one in Ballarat and the one in Bendigo?
I don't have that.
Sure. So the 3 new aged care facilities are Bethlehem Aged Care Facility in Bendigo, Bill Crawford Lodge in Ballarat, and I understand in both those cases it is a single staff member that has tested positive in each of those facilities, and also a Bupa in Edith Vale. So obviously, as I said, we continue to be concerned about the number of outbreaks that we have across aged care facilities in Victoria. They have been to date concentrated in Melbourne, now having facilities in regional communities as well is concerning, and just highlights the fact that all Victorians need to be vigilant about this highly contagious virus at the present time, and there's a lot of work and dialogue happening with the Commonwealth and with the sector around these specific issues.
Is there any suggestion that the workers who have tested positive at these regional aged care facilities have travelled from Metro Melbourne?
I don't have any information to suggest that. I understand that they're both based in those particular communities, but obviously these matters are part of ongoing investigations, and the contact tracing team will always explore all contact that any staff member has in the community and any other sites that they might be working in.
Either of today's deaths linked to aged care facilities?
I don't believe so, no. And both of those people, I understand, passed away in hospital.
Can you confirm there's an outbreak at a regional abattoir, and if so, are there concerns over how the virus got there?
Yes, I am aware of one, and I'm just going to see if I can find those details for you. It is I believe it's a single case at this point in time at the Australian Lamb Company in Colac. I don't have any details about how that was, that particular case was contracted. Obviously, in aged care, even a single case is classified as an outbreak. In other cases, obviously, it's not a single case, but we are aware, of course, of the risks in this particular industry. Brett has spoken about this in the past. The refrigeration, I guess, may create some additional risks. We're aware of this being an issue in the United States and other locations. So we're working very closely with that sector. In the past, we have undertaken testing across various meat processing facilities, and that is something that we are considering at the moment again, and working with that sector to address any risk factors that they might have.
Yes.
There's been some calls to enforce a hard lockdown, or I guess, shut down that semi-permeable membrane between Melbourne and the regions, considering there's this bleed of cases. Is that something you consider, kind of making a hard border rather than allowing people to move through for work reasons?
Well, I think it's very important to acknowledge that nobody from Melbourne or Mitchell Shire should be going outside Melbourne or Mitchell Shire into regional Victoria for daily exercise. There's very few products that you can't buy in Melbourne and would need to buy goods or services in regional Victoria, so that's hardly a reason to be going into regional Victoria. There are people who work, and that work can't be done from home, and that traffic is two-way, whether it be nurses, whether it be members of the emergency services, everyone right down to people that are in that very big and complex supermarket food supply chain. We are asking people to limit their movements. We're asking people to follow all of those rules, to exercise good judgment and common sense. In terms of a harder border, well, again, if I got advice that that was necessary, then of course we would move to that setting, but there's a big logistical challenge with that, and still it's back to people in Melbourne and Mitchell Shire exercising good judgment, regardless of how hard or otherwise the border is. People need to exercise good judgment. Don't be going outside your local community unless you absolutely need to. And that, as I said before, stay at home means just that, stay at home, not travelling a couple of 100-kilometre round trip to go for a walk at the beach, not coming into the centre of Melbourne if you live in the suburbs of Melbourne, unless you absolutely need to. If you can work from home, you must work from home. I wouldn't want people to lose sight of the fact that we have relatively small numbers of cases in regional Victoria. There are some parts of regional Victoria where there are still no cases. The regional public health teams that we're standing up across each of those large regional centres will serve us well, I think, in bringing a local response with all the benefits that come from local knowledge. Being part of a local community will, I think, enhance their ability and therefore our overall ability to keep those communities safe. So they're being progressively stood up at the moment, and we're really working very, very hard to make sure that any positive case in regional Victoria is locked down at home, getting the support they need, of course, but not out and about, not moving throughout the community. Whether it be wearing masks when you can't maintain distance, hand hygiene, cough etiquette, all of those rules, they do apply in regional Victoria, and if everyone plays their part, then we can keep regional Victoria in a stable, very low COVID space. that's not a promise, that's a prediction, if you like, if everyone follows the rules. It's really down to everybody, whether they be in Melbourne or in the furthest point from Melbourne. There are rules, and if everyone follows them, then we'll get to the other side of this.
The President of the AMA wants stage 4 restrictions introduced now. Is that premature?
Well, we'll be based on data, we'll be based on case numbers, chains of transmission, all the other information that you get when you have a proper granular look at the circumstances behind each of those positive cases. If we have any sense, as I've said a number of times, if we have a sense that this strategy is not being as effective as we'd like, as quickly as we would like, then we'll look at other measures. But
what does stage 4 look like?
I'm not going to speculate about what changes might need to be made. Ultimately, if everyone wants to make it less likely rather than more likely that we have changes to the rules, if people want this lockdown to be over sooner rather than later, then thank you to everyone who's doing the right thing. And I have to again appeal to those who aren't. Please make better choices for you, for your community, for every single family across our state. It is a small number of people that are really just not following the rules at all, but each of us have to just exercise that good judgment, do the things you need to do, and only the things you need to do. Those 4 reasons are not an excuse, or they're not an invitation to be out exercising every hour of every day a long way away from your home. That's just not in the spirit of stay at home. If and when we need to adjust these settings, then of course we'll be before you, we'll make those announcements, we'll be as clear as we can be, and we'll try and give people some notice. But that's not for today. That's not something that's been settled. It'll all be based on the numbers as they present each day.
Is today's number a sign that stage 3 is taking effect?
No, I think, well, sorry, yes, that is one way of looking at it. But again, it's only one day, and I think we would want to see a pattern where there was stability and then a decrease in these numbers. That's what the strategy is designed to get us. But again, it's only one day. As Brett said, it's much better than the alternative, much better than yesterday. But the heartening thing here, I suppose, is that there's more tests than yesterday and about half the cases. Again, this does move around a bit. It's wildly infectious and the numbers do jump from day to day. The ultimate thing here is every Victorian has a contribution to make, and if they make it, then we'll get to the end of this quicker than we otherwise would.
We're increasingly hearing claims of delays in contact tracing up to 8 days, or people not being traced at all. Is it still effective? Are you aware of those reports? And
I'm aware of some reporting. Again, what's most important to acknowledge here is that the team is getting close to more than 2,000 now. We've got support from different state government organisations, some Commonwealth public servants, a whole range of corporate staff, and of course ADF, certainly from a leadership tasking point of view. It's a big team, but the task is big too. The task is very big, and it does take time to get to people. They're all doing their very best, but they're always looking to improve every single day. Even if you are meeting every target that you set yourself, you're always looking to do better. That's that culture of continuous improvement. And Grant, I think the key point here is it's a bigger team, but the task has never been bigger as well. So there'll always be, sadly, there will always be instances where despite multiple phone calls, you can't actually connect with the person. Despite every best effort, you can't quite get that full interview done at the first instance in exactly the right time. It's a lot of humans. It's a particularly variable task, but everyone there is doing their level best, 24/7. I'm very grateful to them, but you know it's a big job. It's made easier though if you get a positive result. Then the only thing you should be doing is going home. You will be contacted as soon as possible, but regardless of whether you receive detailed instructions within minutes or hours of being told you're positive, that won't change the fact that you need to go home and you need to stay home. That's what a positive case is all about.
The Ombudsman has confirmed that she's going to be looking into the management of the public housing quarantining. Are you confident that the government went the right way about that?
Well, the right way, if I can respectfully answer your question and make the point more broadly, the right way is to follow the advice. And the advice was very clear. Shut them down, and shut them down now. That was the advice. The Ombudsman can look at whatever she deems appropriate. That's entirely a matter for her. I'm much more focused not on those sorts of matters, but on the challenge we face now and the fact that this won't end unless everyone plays their part. I want to give a shout out to all of those people, hundreds and hundreds and hundreds of people who have literally spent every moment since we locked down those towers providing support and care to every single resident. Is that an easy task? Is that something that there's a handbook? No, it's not something we've ever done before, but they've done their level best, and that's all you can ask of people, is to do their very best.
Can we ask?
Oh, sorry.
Go.
Lawyers are suggesting that now is the time to consider releasing low-risk prisoners, given that there's been an infection reported in a remand centre. Is that something that you would consider, or is there merit?
I've got no announcements to make, and I'm not spending any time considering issues of correctional or criminal justice policy or any kind of reform in that area. We've got a lot of other things to focus on. I would just make the point in relation to that one inmate. That person was handled in full compliance, in full accordance with the rules and the procedures that are put in place. They were never part of the general cohort within that prison. They were in solitary. They were getting the care and support that they needed because, of course, they tested positive. Our Corrections Victoria staff, our public health team, the team more broadly, take their responsibilities very, very seriously. We don't want this getting into prisons. That's not been a feature of the pandemic to this point, but you've got to be vigilant, and that's exactly the approach that was taken in that case. Beyond that, we are all exclusively focused on driving these numbers down, working with every single family across the state to achieve that. Issues of those sorts of issues, they're not unworthy issues, but they're not things that the government's spending time considering at the moment.
And just a question on numbers in the tower, the
Sure.
remaining tower lockdown. Do we know how many people are in quarantine and won't be allowed to be kind of, walking out the doors?
I think we can probably provide you a more accurate figure. It's certainly a third. They're not all positive, I want to stress. That'll be positive cases since the lockdown, or people that have still got symptoms, or people who are close contacts of those who are positive. What that means is that the normal rules that would apply in any household across the state, not just in Metro Melbourne, across the state, if you're positive or a close contact and you haven't done your 14 days since you were tested, then you need to isolate in your residence. I just want to again make the point, I want to emphasise the point that we will continue to provide all those practical supports to those families. They're being visited. Many already have been. There'll be more visits throughout the day. The Minister spoke to CoHealth and others that are using interpreters and community leaders, moving around, speaking to every single one of those residents, making sure they're clear on what their status is once we get beyond 11:59 tonight. The CHO media release might be able to give you some further details on that.
Perhaps this is a question for the CHO or for the Health Minister. 405 healthcare workers testing positive. There's a number then of close contacts and colleagues who'll have to isolate. How are staff in our hospitals coping with that stress?
Well, obviously we have recruited additional staff in all the significant sections or parts of our health system. This is a big challenge. The more and more frontline workers or last line of defence workers, depending on how you want to term them, but the more of our hospital staff that finish up positive, the fact you've got to then furlough large numbers of staff who've been in close contact with them, that is a real challenge. But there's a big team of people that work on all of that workforce management, trying to make sure we've got the right staff in the right place. Again, it'll always be a challenge. That is a much better challenge, of course, than having thousands of people in hospital and many hundreds and hundreds of people requiring a machine to breathe. But it's being managed. PPE is really important, but the behaviour of individual families is perhaps the most important thing. If you want to thank those workers, if you're concerned about their welfare, if you're concerned to honour the fact that they put themselves in harm's way every hour of every shift, every single day, then do the right thing. Don't contribute to the spread of the virus. Do your level best by following the rules to pull this thing up, to drive case numbers down, to see less people in our hospitals and therefore less exposure of this virus to our dedicated health workers. It's a challenge, Jody, but I think we're equal to it. There's been a lot of planning, assuming many more health workers get it, many more people not being able to come and work shifts. We're not at that point yet, but that's why we've always got those contingency plans in place.
Is there a clear understanding of where the gaps are currently in this level 3 lockdown? Is it families still spending time together? Is it people visiting one another for the purposes of care? So do we understand where the spread is continuing?
Well, I think every day you look at both case numbers, chains of transmission, the individual circumstances of people who have tested positive, and you learn things from that every single day. It's an important question, but I think it's another way of asking what stage 4 might look like, and we're not in a position to go through those details now. We're not in a position yet and we may not get to that position where we have to announce significant additional changes. There's been some minor changes, for instance, some advice around trying to exercise in your local community, the notion of day trips as we spoke about yesterday. That was principally so that Victoria Police can have total clarity about how they apply those rules, but it also serves to give people advice. We've seen some stuff on social media the last 24 hours or so. I've got a very clear message to every single Victorian, particularly some of those featured in social media. Whether you're in Broadmeadows or Brighton, stay at home means stay at home. And if walking your local streets is boring, well, being bored is much better than being in intensive care. That's my clear message. The vast majority of people are doing the right thing, and I'm so grateful to them. And I want to give all of them, the praise that they have earned. They are absolutely doing a fantastic job. I know it's frustrating. I know it's difficult. I know no one wants to be under these rules, but there's just no choice if we're going to pull this up. If we have further announcements to make, we'll of course make them. But the likelihood of a longer lockdown, the likelihood of even more restrictions, that really does rest with individuals and families and members of the Victorian community embracing the spirit of these rules and erring on the side of caution. If you've got to sit there and think for 10 minutes, should I do this or shouldn't I? Is it against the rules or not? Then I think the answer should be no, I won't do that. I'll err on the side of caution. I will err on the side of less virus rather than contributing to there being more. Any other issues, guys? Thanks very much. We'll see you tomorrow.